So let's continue with the measurements, and I'm really very grateful that the International Myopia Institute has defined some guidelines in a white paper that was published in IOVS at the beginning of 2019 on the content of optometric examination in myopic patients. And first of all, there is the history taking. And among other things, this involves asking about genetic history, of course, of myopia in the family. Also, the life situation should be asked, for example, all information about the topic of near work. Refraction. Yes, refraction can be performed without cycloplegica, only if indicated a cycloplegic refraction should be used. An example would be the assumption of a near work-induced transient myopia, for example. Binocular vision and accommodation, and for me it's one of the most important part of this measurement series, because we know that several possible causes and risk factors can be found in the accommodation and version system. So let us think, for example, of the topic of near esophoria, or the lack of accommodation, or accommodative amplitude that play a major role in myopia progression. We know that people with near esophoria, for example, or reduced accommodation parameters belong to the risk group for a faster progression. Okay, and the next point, visual acuity, is clear, but what I would like to emphasize here, however, is the consideration of main visual distance is important for refraction and visual acuity. And the main visual distance in the target group for myopia progression is often not the distance, but near distance. That means that refraction should be performed exclusively for distance, or not exclusively for distance, but also near distance should be taken into account. For anterior eye segment, I would like to focus on the central corneal radii and the refractive power of the cornea. And this is really very important in order to filter out which part of the ametropia comes from a longitudinal growth of the eye and which part from a possible change in the refractive power of the cornea, for example. The intraocular pressure should be considered as a risk factor for glaucoma, because we know that the risk of glaucoma is increased by a factor of about 3 with higher myopias. Fundus examination is of course particularly important, because we know that most of the pathological changes associated with myopia are found at the posterior eye. And last but not least, the axial length measurement, the primary outcome measure for myopia. And this is what we will be looking at in the slides that follow now.